My name is Frank Councilman. I'm the Vice Dean for Graduate Medical Education here at EVMS. I'm also a professor in the Department of Emergency Medicine, and I practiced emergency medicine for 36 years. Hampton Roads area is made up of 7 cities. Norfolk, which is where EVMS is physically located, Virginia Beach, which is the most populous, Portsmouth, Suffolk, Chesapeake, Newport News, and Hampton. So really we're able to pull from a very diverse patient population, which is great for training. We have farmland and rural areas, we have inner city, and we have suburban areas.
I think one of the great things about our program here is that from day one, there's no restraints on the patients that we can see in the ER.
We really push our residents to see even the sickest patients very, very early on in their residency. The sooner they start seeing sick patients, the better off they are as they mature as a resident.
Having completed my residency here, I have firsthand knowledge about that progression. And then now as the OB rotation director, I also have kind of supervisory knowledge about how the residents progress through. Eventually, as they become senior residents, they are now responsible for supervising their junior residents. And that in and of itself is an education because you really get to know what you know by teaching it to somebody else. The definition of community faculty are people that are not employed by EVMS primarily, but they are open to taking residents and students as learners in their environment.
It's good to see the different management options and styles as a resident, so by the time we're ready to practice, we can kind of figure out what we like, what we don't like, and then that can help build our practice.
So we have a very diverse patient population in Hampton Roads.
I think that helps us become more well-rounded physicians because wherever we go after residency, it's not going to all be the same population.
We have individuals with military backgrounds, we have individuals who perhaps have farming backgrounds, we have blue-collar and white-collar workers. And so any given day in your clinic, you're going to see a magnitude of individuals with diverse backgrounds.
We have very academic faculty who are involved with research and involved with administration and involved with being national leaders in terms of all the different medical or surgical societies that you can be a part of as a doctor.
Many of our residents seek fellowship programs in the future, and fellowship programs are competitive and require residents to have done some research as part of their training. So we value this aspect of their training and we put a lot of effort into it.
So one of the great things is we have a lot of camaraderie among residents, among the faculty themselves, but then also between residents and faculty.
We can laugh next to each other, we can take care of really sick patients and be serious when we need to.
We have great leadership, a great academic program, great clinical exposure.
This is a gem. I think this is a place that I unfortunately was not aware about before I started applying for residency, but I'm so grateful that I'm here because we have an incredible diversity patient population, a diverse workforce as far as residents and attendings as well. We have a really, really well-rounded education as far as community outreach, research, and clinical patient care.